Today we will introduce the meridian circulation or bladder meridian of foot Taiyang. The bladder meridian of foot Taiyang is one of the three yang meridians of foot. We have learned the three yang meridians of foot in the general theory. The circulation of the three yang meridians of foot is from head to foot. The same is true for the bladder meridian of the foot. But where exactly does it start depends on where the meridians stop in front of it. We learned the small intestine meridian of hand Taiyang. Is the small intestine meridian finally ending in the inner cancers? When it stops at the inner cancers, it communicates with the bladder meridian of foot Taiyang. Therefore, the bladder meridian of foot Taiyang begins at the inner cancers. So how it does work? Let's take a closer look. Bladder meridian starts from the inner cancers and then ascends to the forehead, communicates with governor vessel on the vertex. The branch from parietal region arises from the vertex and runs to the temple. The straight branch of the meridian enters and communicates with the brain from the vertex. It comes out and descends along the occipital and nape, and then downwards along the medial side of the scapular region, and parallel to the vertebral column, reaches to the lumbar region, and enters the vertebral muscle to connect with kidney and join its pertaining organ, the urinary bladder. The branch of the lumbar region downwards along the vertebral muscle through the gluteal region and ends in the popliteal fossa. The branch downwards along the medial border of the scapula through the vertebral muscle, pass through the hip joint, and downwards along the posterior lateral side of the thigh to meet preceding branch in the popliteal fossa, descends through the gastrocnemius muscle to the posterior side of the lateral malleolus, then runs along the tuberosity of the fifth metatarsal bone and reaches to the lateral side of the tip of the little toe. Don't think it's complicated. It is a relatively simple meridian in the three yang meridians of the foot. We divide it into 5 branches. Looking at it in this way is not completed. Next, we will explain each one. First, let's look at the first branch, which is the one from the inner cancers to the top of the head. Then we can name this one the branch of the Jingming to the vertex. It from the inner coronal cancers to go up, after through the forehead to the vertex, and then communicates with governor vessel on Baihui acupoint of the vertex. The second branch is from the vertex to the temple. This is an easy one, because the top part of the head is in Baihui point. We can name it the branch of Baihui. The third branch is from the top of the head to the bladder. This one needs to follow both the body surface and inside, so we can name it the branch of the body surface and inside. It enters the communicates with the brain from the vertex. This is only meridian in the 12 meridians that enters and communicates with the brain. It comes out and descends along the occipital and the nape, and then downwards along the medial side of the scapular region, and parallel to the vertebral column. Then we can see in the picture that there are two straight branches on both sides of the medial scapula and parallel to the vertebral column. This branch is located on the medial side, which is 1.2 away from the posterior midline. It reaches the lumbar region where it enters the body cavity via the parietal muscle to connect with the kidney and join its pertaining organ, the urinary bladder. This is the third branch. So now we looked at the fourth, from the lumbar region to the popliteal fossa. This one is relatively simple. We named it the branch of the waist to popliteal. The last meridian reaches to the waist. This meridian branches from the lumbar region and descends along both sides of the spine through its cord along the parietal muscle. It has to pass through several acupoints of the original meridian, includes burial point. The branch downwards along the gluteal region, past the Chenfu point at the gluteal strap. Finally, it reaches Weizhong point of the middle of the popliteal fossa. It is the fourth branch. The last meridian is longer, downwards from the medial side of the scapular region to the lateral side of the tip of the little toe. This one mainly follows the lower back. We named it the branch of downward on the back. The branch that descends from the medial side of the scapular region is the second, lateral branch that we just mentioned, which is 3 cun from the midline of the posterior midline. This branch also descends along the muscles on both sides of the spine to the hip joint and passes the Huantiao point on the hip joint, then downwards along the posterior lateral side of the thigh and joins the previous meridian in Weizhong point of the popliteal fossa, then the 2-2-1 through the gastrocnemius muscle, through the posterior side of the lateral malleolus, through the tuberosity of the fifth metatarsal bone, and reaches the lateral side of the tip of the little toe. This is meridian, a total of 5 branches. Here is a simple diagram. I hope you can remember the meridian's circulation. If you can't remember it, you can remember this circulation diagram. The meridian comes out from the inner cancers, then passes through the forehead and communicates with the governor vessel on the vertex. A branch runs to the temple, and another branch enters and communicates with the brain. Then it downwards along the medial side of the scapular region and parallel to the vertebral column, reaches the lumbar region. After reaching the waist, pass the paraspinal muscles, then enters the body cavity to connect with the kidney and join its pertaining organ, the urinary bladder. Another branch after branching out from the lumbar region. It downwards along the parietal muscle, just as this branch would pass through the burial points, through the gluteal region, and ends in the popliteal fossa. There is also a branch that descends from both sides of the spine. It runs the second lateral line of the bladder meridian. It also downwards along the parietal muscle, passing through the hip joint, and joins the previous meridians in the popliteal fossa, and it downwards through the gastrocnemius muscle, and then along the posterior side of the lateral malleolus, reaches the tuberosity of the fifth tarsal bone, all the way to the lateral side of the tip of the little toe. This is a sample diagram. And then we are going to watch a videos on the meridian to deepen our impression.
Taiyang mainly distributes at the head,
主要循形分布于头部、
sacrum,
项、
and the
背、
posterior border
腰、
of the lateral
底
aspect of the
和
lower
下肢
limb.
外侧后缘。
It starts from
起
the
于
inner
眼内角，
ascending to the forehead.
上行额部，
It joins the due meridian
交
at
汇
the
于头顶。
vertex. From the vertex,
头顶部
a
之脉
branch arises,
从
running
头
to
顶
the
部分
temple.
出，至耳上角。
The straight portion
头顶
of
部
the
直行
meridian
主干，
enters and communicates with the brain
从
from
头
the
顶
vertex.
入颅内，落于脑，
It then emerges at
回
the
出
nape
下
and
行至项
bifurcates
部，
into two branches
分
to
两
go
支下
down.
行。
One branch runs downward
一支脉
along the
沿
medial
肩胛
aspect
内
of the
侧，
scapular region
夹脊
and
两旁至
parallel
腰
to
中，
the vertebral column. It reaches the lumbar region, where it enters the body cavity through the
从脊
tendons
房筋
and
肉
muscle
进入体
beside
腔，
the
落
vertebral
于肾。
column. It connects to the kidney and pertains to the bladder.
属于膀胱。
The branch of the
腰
lumbar
部之脉
region descends alongside the
从
spine.
腰中分出，夹脊旁下行，
and goes through the
穿过
gluteal
臀
region.
部，
It further descends along the posterior border of the lateral aspect of the
沿大
thigh
腿外侧后
and
缘
enters the popliteal
进入
fossa.
腘窝，
Another branch
项部
from the
另一支
nape
脉
runs down along the medial
从项部
border
分
of
出
the scapular.
通过肩胛内缘，
Parallel
夹
to
脊下
the
行，
vertebral column. It passes
经
beside
过
the
股
great
骨大
trochanter
转子部，
along the posterior
沿
border
大
of
腿
the
外侧
lateral
后缘
aspect
下
of the
行，
thigh to the
至腘
popliteal
窝
fossa.
与前肢汇合，
From there, it
由此
meets
向
the
下，
preceding branch
通
and
过腓
descends
肠肌
through
部，
the gastrocnemius muscle to the posterior aspect of the
出走
external
外踝后方，
malleolus. Then running
沿
along the
第五蹠骨
tuberosity
粗
of the
隆
fifth
至小指
metatarsal
外
bone,
侧端，
it reaches the lateral side of the tip of the little toe,
与
where it
足少
links
阴
with
肾
the
经相
kidney
接。
meridian of foot 少阴.
We just watched the video of the bladder meridian of the foot Taiyang. You have certain impressions in your mind. Make sure you keep it in mind. Where exactly does it go from? So I give you a diagram to help you remember. And I hope you can write it down. Then I will show you the picture while teaching the diagram. First, let's look at the diagram for the number 1. Bladder meridian goes through inner cancers, forehead, and vertex, which is from the inner cancers through the forehead to the vertex. This is the first one. The second from the vertex and runs to the temple. The second one we just talked about, the branch from the vertex to the temple. The straight one from the vertex to communicate with the brain. It reaches the lumbar region and follows peripheral muscle to connect with the kidney and bladder. This is the third branch. The branch from enters and communicates with the brain from the vertex, and then downwards along the occipital and nape, passes through the medial side of the scapular region, and then goes down along the side of the spine. The branch is one that 1.1 away from the midline of the posterior on the diagram we just learned. Then reaches the lumbar region where it enters the body cavity to connect with the kidney and join its paternal organ, the urinary bladder. This is the third branch. The fourth from lumbar and downwards along the vertebral muscle. It through gluteal region and ends in the popliteal fossa. It is the fourth branch. The fourth one comes down from the lumbar region, then descends along both sides of the spine, goes through the position of burial points, then the fifth one, the fifth downwards along the scapula. It descends from the medial side of the scapular region, runs the second lateral line of the bladder meridian, downwards along the pervertebral muscle, reaches the hip joint, and joins the previous meridian in the popliteal fossa, then enters and downwards along the gastrocnemius muscle, through the posterior side of the lateral malleolus, through jingu, the tuberosity of the fifth metatarsal bone, and reaches the lateral side of the tip of the little toe. There are some ancient terms in the doggerel that you need to remember, and these are some ancient anatomical terms. For example, the first one, following the medial side of bow, this bow refers to the jianbo, which is the scapular area we are talking about it. Next, look at the word 捋. The 捋 refers to the muscles on both sides of the spine, which is equivalent to the erector spine muscles that is named by Western medicine. Next one is 臂枢. The 臂 of the 臂枢 refers to thigh. 枢 means pivot, so the 臂枢 refers to hip joint. Next one called 踹. The word refers to the gastrocnemius muscle. The last one is 筋骨. 筋骨 refers to the fifth metatarsal tuberosity. The cycle of the bladder meridian of the foot Taiyang is relatively complicated. It runs from head to foot and hands over the meridian qi to the kidney meridians of foot Shaoying at little toe. Remember the organs it connects to. It connects the brain, and that's important to remember because it's related to the brain and that is associated with a number of diseases. For example, some acupuncture can relieve convulsion, stop endogenous wind, weaken the brain open, and induce resuscitation. It is also because some acupuncture can treat symptoms of the organ where the meridian passes or it connected, because this meridian enters brain. The meridians also connects the zang and the fu organs, including the exterior interior organs, bladder and kidneys. Regarding organs, the inner cancers and the temple are the main contents. We must also remember these two. Inner cancers refers to the acupuncture around the eye, such as Jingming and Cuanzhu, which are our main points for treating eye disease. There are also some remote acupuncture that can be treated according to the meridian. This is also because the circulation of this meridian is from the inner cancers. What about the circulation on the body surface? The main route is the posterior back, the nape, the lateral back of the lower limbs. So the whole circulation is on the back side. It is also important to remember, especially in the back and the nape, This is clinical meaningful. For example, when treating headache, we should identify meridians and collaterals and ask the patient about the specific location of the headache. For example, we have learned the stomach meridian of foot Yangming. We know that this is mainly follows the forehead, so the headache in the forehead belongs to the stomach meridian of foot Yangming. This meridian follows the occipital part, so we see that the headache of the occipital part belongs to the Taiyang meridian. This is based on the meridian differentiations. Of course, it passes through the back, so many of the syndromes of the back area also belongs to the Taiyang meridian. Well, we have finished all the content.